All right, let's dive right into this explainer. Today, we're going to re-examine pretty much everything we think we know about addiction and how we treat it. Think about someone you know who struggles with a really stubborn, destructive habit. Maybe it's something you've struggled with yourself, right? You might wonder, why is it so incredibly hard to just stop? Well, for decades, the dominant cultural narrative has told us that addiction is a problem of willpower, a moral failing, or maybe just a reckless, thrill-seeking pursuit of pleasure. But there's a massive paradigm shift happening right now in the scientific community. We're actually starting to view addiction through an entirely different lens, one that zeroes in on the nervous system, our sensory environments, and that profound, undeniable connection between the body and the mind. So today, we're exploring a really groundbreaking framework that uses multi-sensory healing and physiological regulation to completely rewire how we approach habit replacement and recovery.
So the crucial point to get here is that addiction is rarely just some reckless pursuit of a good time. This quote by Dr. Edward Kansian really hits the nail on the head. It's actually a self-regulation disorder. It's driven by a desperate, often subconscious need to soothe just unbearable internal pain. Now that pain could be rage, deep shame, profound loneliness, or maybe paralyzing anxiety. People struggling with addiction aren't necessarily chasing a high, Instead, they're desperately trying to find a baseline of safety. Like Dr. Kansian says, they are just trying to find a place in life where they can finally breathe. To understand how we can actually heal this nervous system problem, we're going to follow this quick roadmap. First, we'll look at the root of addiction. Then, we'll explore the four senses sanctuary. Third, the science of sound. Fourth, why we have to treat the body before the mind. And finally, rebuilding purpose and meaning.
Okay, let's jump straight into Section 1, the root of addiction. Let's see how this builds our understanding of why people get hooked in the first place. What's really interesting here is that there's actually no single addictive personality. Instead, research points to this volatile composite profile. It's like a perfect storm of vulnerable traits colliding all at once. You frequently see high neuroticism paired with low conscientiousness and high impulsivity, which creates this massive urge for sensation-seeking. But, and this is absolutely crucial, it's not just an internal problem. These vulnerable traits collide head-on with external social pressures, things like social modeling and peer pressure normalization. Think about how vital human connection is to our survival, right? Many people initially pick up addictive behaviors simply to gain social acceptance, to bond with a group, and honestly, just to avoid being the odd one out. So you end up with predisposing personality traits, internal emotional pain, and a social environment that actually rewards the destructive behavior. And that leads us perfectly into the self-medication hypothesis. Basically, this theory suggests that a person's choice of substance or behavior isn't random at all. It's actually unconsciously matched to the exact emotional problem they're trying to soothe. So an anxious person might reach for a depressant just to quiet their racing mind, while someone battling lethargy might reach for a stimulant. If a person is self-medicating literally just to survive their own intense internal distress, taking away their coping mechanism without offering a replacement, well, that's practically a guaranteed recipe for relapse. This is exactly why sheer willpower and punishment almost never work. We have to focus on lowering that physiological distress first in a deeply supportive, non-punitive way.
Which brings us to Section 2, the four senses sanctuary. Let's look at a revolutionary environmental solution designed to counter that exact fight-or-flight state.
Enter the four senses chill-out space. Now, this isn't just a relaxing room. It's a targeted, multi-sensory environment backed by hard clinical data. It is literally engineered to physically shift the body out of that hypervigilant state and into a state of profound calm. Looking at the evidence here, touch is addressed through low-frequency vibroacoustic mats, which are shown to improve sleep and lower stress. Smell is engaged with essential oils like bergamot and lavender. Randomized controlled trials show these significantly reduce anxiety in patients with substance use disorders. Sight leverages nature scenes or even VR to activate the parasympathetic nervous system and drop those cortisol levels. And sound uses inspiring nature or meditation music, which trials show actually increases a patient's readiness for treatment. The whole shebang is designed from the ground up to make the nervous system finally feel safe. All right, moving to Section 3, the science of sound. Let's zoom in on the specific mechanism that really anchors this sanctuary. Now, when I say sound massage, you might be picturing those clunky mechanical massage chairs at the mall that just aggressively squeeze your muscles. Actually, scratch that. This is entirely different. It's called vibroacoustic therapy, or VAT. It utilizes pure, low-frequency sound waves, specifically between 30 and 120 hertz, delivered through transducers in a specialized mat or recliner.
Here's the cool part. Because the human body is roughly 60 to 70% water, and water transmits sound about 5 times more efficiently than air, these vibrations travel deep inside you. It gives a harmonic, soft inner body massage to your organs, tissues, and cells using a process called mechanotransduction. Mechanotransduction is basically a fancy scientific way of saying it converts physical vibration into biological stress relief. It literally turns those sound waves into cellular signaling that flood your body with common chemicals like GABA, oxytocin, and endorphins.
The clinical application of this is just incredible. In one highly relevant 30-day study, researchers applied this exact vibroacoustic intervention to 76 patients suffering from severe addiction disorders. The results weren't just subtle little shifts, they were massive, measurable improvements across the board. Patients experienced dramatically better sleep, lower overall stress levels, reduced cravings, and a huge drop in anger. By directly addressing the physical hyperarousal first, the therapy fundamentally changed their behavioral symptoms. It proved that calming the physical body is for sure the very first domino that needs to fall.
And that brings us to the core paradigm shift in Section 4, Body First, Mind Second. Here is why the order of treatment is absolutely a game changer. There is this vital synergy between bottom-up and top-down therapies, and you literally have to get the sequence right. You can think of vibroacoustic therapy as a bottom-up tool. It targets the physical body directly, turning down the dial on that physiological hyperarousal and essentially clears the desktop of the mind. Only when those physical alarm bells finally stop ringing can the optimized inner conditions exist for top-down psychological work, like cognitive behavioral therapy, or CBT, to actually take root. Think about it. If you try to do CBT and challenge someone's negative thoughts while they are actively in a state of fight or flight, well, it's like trying to teach algebra in a burning building. The body has to be calmed first.
So this creates a really clear 3-step chain of habit change. Step 1, you regulate the body and quiet the internal noise using VAT. Step 2, with that newfound physical calm, the person experiences increased interoceptive awareness. That's the ability to safely notice your own internal physical and emotional signals without panicking or immediately needing to escape them. Step 3, this new self-observation creates a state of therapeutic readiness. It opens up this critical transition window where cognitive restructuring and new adaptive behaviors can be introduced, genuinely learned, and most importantly, actually retained.
Finally, we arrive at Section 5, Rebuilding Purpose and Meaning. Because once the mind is cleared and habits are shifting, we have to fill the massive void left by the addiction.
You can think of the VVI plus 2W protocol as your holistic maintenance plan for keeping the nervous system balanced. It goes way beyond just abstaining from a substance. VVI stands for visualization, imagery, and vibroacoustic therapy. By visualizing positive health outcomes and creating rich mental stories, that's the imagery part, while in that deeply relaxed, almost hypnotic state induced by VAT, these positive scenarios become deeply embedded in the subconscious. Then you add the 2 Ws, wellness and well-being. Wellness is about actively managing external stuff, the food you eat, getting sunlight, breathing fresh air. Well-being focuses on internal habits, like cultivating healthy sleep and maintaining a positive attitude. Woven all together, this protocol empowers people to proactively maintain their resilience and literally retrain their immune and nervous systems to work in absolute harmony. Remember how we discussed earlier that substance use often starts as a way to find social belonging? Well, when you suddenly remove the substance, you leave a massive painful social void in that person's life. Just look at this chart. Spirituality, life meaning, and social support account for a full 22% of the variance in life satisfaction during recovery. That is huge. Whether it's joining a support group, engaging in creative arts therapy, or volunteering, finding a new purpose and a healthy supportive tribe is psychologically essential to replacing the social function that the addiction once served. You can't just take the bad habit away. You absolutely must build a meaningful life in its place.
And when it comes to building that new life, timing is literally everything. The data points to a distinct, critical window for neuroplastic consolidation. The sharpest decline in relapse risk happens within the very first 3 months post-intervention. Those first 90 days are make or break. If you don't continually link those new cognitive insights to a physically calm, VAT-induced state during this specific time, the new brain wiring simply won't stick. Repetition is key here. Practicing these skills repeatedly during these 3 months actually rewires the neural pathways, making the incredibly hard work of habit change endure for the long haul. I want to leave you with this final thought to ponder as we wrap up this explainer. If we truly accept that addiction is a disorder of self-regulation, a desperate cry from a dysregulated nervous system rather than a moral failing, it kind of changes absolutely everything, doesn't it? It forces us to look around at our sterile clinics, our high-stress homes, and our noisy communities.
True healing starts not with isolation or punishment, but by creating an environment where the nervous system finally feels safe enough to change.
Please contact us today to learn how to add 4 Senses chill-out space into your addiction recovery place.